Hello, welcome to today's episode of the Public Health Spotlight podcast in partnership with ADPH. Today we're joined by Stephen, who's the director here at Stoke. Stephen, great to have you.
Good to be here.
Thank you. So to get us started, Stephen, it'd be great to hear a little bit about your career journey. Previously, when we've met, it has fascinated me. So if you could take me through your pathway that's led you to this position, that'd be great.
So I wanted originally to be in nutrition, and I've ended up becoming a director of public health. So it's been a bit of a journey. And as I say, I ended my university career, went into a primary care trust, went to work on many different things, but specifically to increase physical activity. That led me on to many other roles within the primary care trust at the time. I then did my training, so formal training applied to go onto that. Had a brilliant experience, brilliant training program. That was working in primary care trusts, and during that period we had the transition into local authorities. Also did work at national level, international level at the European Commission, which was fascinating. And then moved on in terms of regional government, as I say, Regional Public Health England, as well as then into local government as well, and various different roles across local government, which have all been varied, all given me something different and all given me something new to learn.
Brilliant. It's quite a unique pathway. Can you tell us a little bit more about the European work you've done and how that's influenced your role? Because it isn't something that's quite as common with directors, is it? It's certainly unique.
Yeah, and I think it was a real experience for me during my training program, and I was working with a non-governmental organisation, NGO, which was trying to get sort of 16 different member states to sort of get equity into policy making at a national level. And a few things that I've really taken away from that was, one, we all come with different views, different thoughts, different perspectives on life. Sometimes our European partners did become stereotypical in some of their behaviours. Our Italian colleagues were quite late, wanted to party, and some of our German colleagues are very on time and didn't. So diplomacy was one of the things that I learned, and sort of really listening in and learning basic language, but again, predominantly English. And I think that the thing that I've taken away from that work was very much around everybody comes with a different perspective, a different view, different ideology, different experiences. And whether you're working at a European level or local level, everybody comes to those experiences from that, and it's working with them and finding that collective and common goal together. And to do sort of the work that we did was, to say, is fascinating in terms of working across those different 16 member states, but taking that learning into local government now. Different parts of the community are very much the same. So it's that diplomacy, it's that listening, it's that collective working, common goals. You can bring anywhere.
Brilliant. Yeah, absolutely. Yeah. Was there a pivotal moment or an experience that kind of took you on that pathway into public health and becoming a director? What was it that made you go, this is it for me?
I don't think I ever grew up wanting to be a director of public health. I think there's a number of people, a number of experience that shaped me. So when I was a young child, my uncle took his own life, and again that was through relationship breakup and other things, and that really sort of shook me up as a young child, and really thought around how I could do something different to support people, because he was a wonderful guy, life and soul of the party, but sadly ended his own life quite early. Secondly, a similar colleague I was playing rugby with, and again in my late teens, took his own life again, and again still affects some of my ex-teammates now, and again gave me the sort of, well, okay, what can I do? And then I lost my mum, actually, in terms of from cancer. Again, sort of a year or so later, and that sort of spurred me into, I'm sure there's more things I can do, and that sort of led me into public health and finding out what I can do in the field to support and help others.
Yeah, well, you've certainly done a good job of that, that's for sure. In terms of your role then as director, it actually extends beyond public health here at Stoke, doesn't it? You've got quite a unique portfolio. Can you tell us a little bit about that and some of the challenges that come with that, but also the opportunities to kind of intertwine with other areas of the council, with other strategies?
So yes, as the statutory director of public health, we've got to do the principal role, the statutory advisor, and protect the population of Stoke-on-Trent. The other services that I currently manage in terms of leisure and wellbeing, we've got our public protection, so trading standards, environmental health, pest control. I've also got our bereavement care services. So again, making sure we act with humility and dignity at particularly vulnerable points of people's lives. Also lead around domestic abuse. We've got a whole Family Matters program, which is supporting children and families to lead fulfilling lives, as well as community development and I'm sure a few other things that I forgot earlier. And I think what I suppose the opportunities are is how do we sort of connect and embed. So we're doing a whole program with our leisure and wellbeing, making sure we've got a commercial core for that, so we're a viable service. But also then working through our sort of weight management, our health checks offer, our community-based activity offer, which is really sort of driving the outward reaching. So making the money through the sort of commercial core and then reinvesting that into the social good of what we're here to do in terms of public health. Similar with our Family Matters program, and again, working with our children's services, working with our community sector, working with local faith leaders and also trusted organisations across the city, taking that public health approach, that societal-based, community-based approach, and employing it into that program, which will ultimately have greater benefits, which is reducing the number of children in our care. So, which also makes the council financially viable in the long term. So it's gives those opportunities, as well as sort of applying those principles, evidence base, the skills and training that we've been trained in public health to apply to other areas as well.
Absolutely. And I think having those services joined, as unique as the portfolio maker might be, there are clear benefits, aren't there? And it's nice to hear you explain some of them. Stoke as a city, it has some natural challenges, doesn't it? Some of those can be community tensions and I think high infant mortality rates. Can you tell us a little bit more about the Directorate's plans over the next 12 months of priorities for tackling some of those challenges?
Well, so the city celebrates its 100-year status this year. So the 5th of June, we had a celebratory sort of civil service for that celebration. And fortunately my annual report, which will be at another statutory role we have to do, has looked back at the sort of challenges, hopes, aspirations of the city in the last 100 years, but also looking forward to the next 100 years of the city. So we are a city that's forging mud into ceramics, in terms of the potteries. Yes, we've had reductions in sort of heavy industry, whether that be the coal mining in the city. Ceramics has obviously taken a number of hits over the last few years, but again, we're a city of high economic growth. We've got Silicon Stoke, we've got huge investment coming into the city as well, which again we need to, from a public health perspective, work to support the community to sort of benefit from that. So from a public health perspective, we our main challenges is around mental well-being. So how are we mentally well and fit and supported, but supportive of each other. Secondly, we've got huge issues with addictions. So whether that'll be food-related ill health, whether that'll be tobacco, whether it be alcohol, other substance misuse, is a key priority for us. And the other thing that we're really pushing on, whether it's our Family Matters program, our community development, I think is that community of kindness and that community development. And again, we're unique in the country in terms of we've got 6 towns. And again, it's working through those sort of 6 districts, 6 towns to rekindle that community connectors. We're not known as the kindest city for a reason, because the city is very kind. It's how we build on that kindness across the city is one of the key priorities for us as well.
Absolutely. And it's nice to hear you talk about some of the programs and initiatives that really matter. How do you measure the success of those programs? How are you doing that, particularly with the Family Matters program that you mentioned?
So with Family Matters, this is really about the outcomes for children. We measure that through children in care. Is a sort of typical measure, but more importantly, it's those relationships, connections, and the voices of the children and families across the city, which we listen to all the time. So, have we got the right support? Are we doing the right thing? Have we got the right connectivity in our communities? Is that listening element that we need to do, and we also do that with those that are involved in the program. So we run family support through locally trusted organisations because they're trusted in the community. They might not trust us as the sort of statutory body. And they tell us whether we're doing things right or not in some cases. And it's up to us and the team to respond to those challenges and continue to evolve, because we don't stand still, do we? So community evolves, society evolves. So how do we continue to review and reflect the needs, wants, hopes, desires of the community? So yes, we look at the data. Yes, we look at the usual statistics that we would in public health, but it's also important to listen to the community or communities in what they're telling us and being able to respond appropriately.
Yeah, absolutely. And I think you've really highlighted kind of the key focus and involving those communities. And I think that really does help. And I think as a city, you've clearly valued that, and that's really positive. And in terms of some of the projects and initiatives you have led, is there one that stands out to you that you're most proud of throughout your time with Stoke?
Oh, good question. As I say, there's lots of different, ironically this week I bumped to an old colleague and sort of talking about a program that we run 5-6 years ago and still running.
Yeah.
I mean, one of the things I think as I set up, as I say, one of my first jobs was, our exercise referral program. And that was very much working with our local leisure providers, as well as obviously primary care in terms of referrals. And that program's still running. So we set it up as a, sustainable model almost 20 years ago. So, testament in terms of, the initial thinking, and that's still running, which is fantastic. And listening and when we were, the case studies and the stories of individuals through those programs is always humbling. I think the other key element is to say, with the European program, we got one of the countries to invest millions into sort of equality research and government policy. So, which one is best? I wouldn't say very, very different. And I think as much as possible to leave a positive trail and support, and ultimately as a manager, a leader, you're there to support others, and make things as best for others as possible, whether it's your team, whether it's the communities you serve.
Brilliant. And one thing I did want to mention was the LGC Awards. So you had a nomination recently, didn't you? Can you tell us a little bit about that and what it meant to the team?
Yes, this was our work with local communities to increase MMR vaccination. So just before I arrived, we sort of had a measles outbreak in the city. Lots of great work happening to respond to that. And one of the key things was, well, how do we get to those and work with those that are least likely to take up vaccination? And the team, yourself and the team very much went out to listen. If it's a common theme there, go and discuss, identify some of the key barriers to why communities weren't taking up, advocate for local community leaders and voices to promote vaccination uptake. So a long story short, but through all those conversations, we were on a sort of agile, flexible delivery of vaccinations. We had local community leaders and non-faith leaders promoting the vaccination, and pop-up clinics working with the NHS to provide that as easy as possible. We increased vaccination rates, particularly in our least, those areas with least uptake in the city over a relatively short period of time. Our rates now in terms of vaccination are roughly in line with the sort of national average, but provides that protection across the community. And I think the evaluation of that program, particularly from those community voices, was you responded, you've listened, you gave us the confidence. And again, we're using that learning in other programs and which we're doing. So we take one thing as a team, we review and reflect on it, but also then say, how do we apply that into other areas of the work in which we do?
Wonderful. That's great to hear. And one thing I did want to discuss with you, as we've discussed in the past, is aspiring directors. So naturally, it's a very tough role to get into, becoming a director. What advice would you have for those that are on that journey now?
I would say go and get as much experience in different fields as possible. The experiences I had before I became a director, I've did adult social care commissioner, I've led community programs, I've worked on corporate strategies and other areas, as well as sort of NHS programs and projects as well. So if you are thinking about it, really broaden your experience. learn what it's like to work in a corporate centre, or learn what it's like to work with our children or adult social services, or other community or planning or housing, etc. Get that broad breadth of experience. I think directors these days will be getting more and more services or responsibilities. I think the core public health training in terms of consultant gives you the evidence base, the ability to bring people together, the ability to run programs, look at data, look at statistics, so on and so forth. They're really core skills and which you can apply to any topic. And again, it's adding that value to local councillors, like the council partners as well. And I think giving yourself the range of experience, the stories to tell at any interviews, and that reflective practice as well. I would say, what have you learned from it? How you've developed yourself as part of those experiences is always crucial as part of any interview process. And again, if you're interested, go and speak to members. What are their issues? What are their concerns? What are they wanting to get out of the role? What are their issues in the community that the Director of Public Health and their team will be able to support with?
Yeah, I think you're absolutely right. And one key thing you mentioned, those members. And I think knowing your community and having involvement in that and understanding your community is very important for anyone aspiring to be a director. So yeah, great piece of advice. One final thing just to round us off. From your perspective, what does public health look like over the next few years and what opportunities are there?
Well, I think public health is going to have to morph into other places and spaces. What does that mean? It means, well, actually, how are we talking to business? How are we talking to investors? How are we talking to partners? We think through the fundamentals of good well-being, good health, good homes, good jobs, good social networks. Recently sort of summarising that in our communities, our people, A, want somewhere to go. Is that a good home? Is that a good community space? B, want something to do. Is that volunteering? Is that job? Is giving your time and so forth? And thirdly, people want someone to love, and if that's family, if that's friends, partner, pets, etc. Even, they're the three fundamentals that sort of keep human society together. So how are we acting in those places? So what are we doing in terms of good homes? What are we doing in terms of the good jobs nature? How are we interconnecting? How are we building, designing places in which bring people together? How are we having those conversations around business and, ill health related to poor food, etc., to food, etc. And I think, we need to understand the big P politics in terms of obviously supporting members and their ambitions, but also understand the little P politics. So how do you get things through? What's the nuances in policy? How do you change strategy, direction, and sort of lead and advocate for those that are unable to? It's a key role of the director. I think one of the things for Stoke-on-Trent, is our sort of city motto is Una Unita Fortiae, which is united strength is stronger. The six towns coming together. And I think that's something we could, we're taking as a team, but something we can learn from is actually with our collective efforts, our collective voice, critically important, whether it's to lobby in terms of different national government policy, or whether it's to, have the detailed understanding and understand our members and our members and to deliver good quality and high value support for them as well is critical for us. So what I summarise that, understand the big P, little P politics, understand and work with a range of different partners and actors, look at what influence you can do as yourself and as a team, but also make sure you've got a good delivery record as well, and keeping those promises.
Brilliant. Look, Stephen, it's been great to have you on the podcast today. Thank you so much for doing it. Really looking forward to seeing how the next few years go for you leading at Stoke. Thank you to everyone at home for tuning in today. We look forward to keeping you for the next episode.